Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Monday Health Minutes. Pregnancy is a wonderful thing. Nausea and vomiting usually can come along with that, and that's not so much fun, but 70 to 80% of women have some type of nausea and vomiting. Usually it lasts a little bit. Sometimes it can last the whole duration. So today we're talking with obstetrician and gynecologist Dr. Ellie Hood about that, about what's normal and when do we worry. So when does nausea and vomiting, when does this usually kick in pregnancy?
Yeah, absolutely. A lot of people refer to this as morning sickness,
yes,
but you might know it's any time of day sickness.
Afternoon, evening sickness.
Absolutely. Yes. So, I mean, even smells can set it off, anything really. The car, riding in a car, that becomes more prominent. It usually starts to ramp up around 6 weeks pregnant when all those hormones have built up. It peaks around 9 weeks, and then hopefully for most patients it's over by the end of the first trimester. However, it can last longer than that, and then like you said, the entire pregnancy sometimes.
Yeah, and we really hope that doesn't happen very often because it's not that much fun. What is normal as far as getting sick, and when do you worry?
Yeah, I mean, some people may, just feel sick to their stomach and not actually vomit. Some people may vomit, small amounts, once or twice a day. Some people can just not keep anything down at all. And the severe form of that is called hyperemesis gravidarum. And that, a lot of times we have to treat in the hospital. But we worry when patients exhibit signs of dehydration. So, not being able to keep food down is usually okay, short term. But if you can't keep liquids down, then that's a problem. So we would really want to know if somebody was not able to keep any liquids down. If they were only urinating small amounts, unable to urinate at all, we want to know about that. If they stand up or they feel dizzy or faint, that's a sign of dehydration. And you really need to let your OB know so that we can, figure out what next steps are.
Yeah, try to find some help for it. Speaking of help, are there medications that can assist and try to keep the nausea at bay a little bit, or at least diminish it?
Yes, absolutely. Well, we try to get patients to kind of change their lifestyle first.
Okay.
So a lot of times, I suggest crackers before you get out of bed. I know that sounds gross to eat in bed, but eating those saltine crackers can really help settle your stomach first thing in the morning. Eating small meals more frequently can help settle. Just having some hard candy around, Jolly Ranchers, peppermints, that can be very effective. C-bands will work a lot of times too, and that's a non-medication option. If those things fail, then we do move to medications, and we generally start with over-the-counter medications that have been proven very safe in pregnancy. The first one is vitamin B6. We will add Unisom or doxylamine to that, and that can help make the patient sleepy. So sometimes we take that at night. Sometimes we add daytime doses. Dramamine is another helpful medication that you can buy over the counter. And then once those things, if the patient's still having significant vomiting, then we will move to prescription medications, such as Zofran and Phenergan are two of the most common ones, but they do have side effects. There's minimal risk to the baby, but we do like to minimize the side effects and the risks, so we use those as a last resort.
Okay, so you kind of build through that and cross off all of your other things. I always found that salty foods helped me the most versus the sweet, but the peppermint can be really helpful.
Yes.
And so if none of these changes work, how often should you be having this conversation? I mean, you're already going to the doctor every month, so is this a conversation you always update your OB whenever you go in and say, for a baby check, and say, I'm still struggling with this?
Yes, absolutely. We're checking, at every appointment early on for sure, and then the patients who are having significant symptoms, we bring them back usually before the scheduled time to check on them and make sure that they're not getting dehydrated.
Yeah, dehydration can be very serious. I mean, not just for the baby, but for the mom as well. Like you said, dizziness, their risk of falls, and things like that. What else should people be thinking about as far as nausea and vomiting, and how they can maybe prevent it and get it to end quicker?
Well, I mean, I'm not sure that it's just going to end when it's going to end. So
there's no magic to it.
Exactly. There's no magic, but I think you just got to find what works right for you and what combination of those lifestyle modifications work, and then which prescription medication or over-the-counter medication works well for you, and what, for example, what time of day to take it.
Right.
A lot of people do better if they take their prenatal vitamins at night. That can help ease their stomach. And sometimes if they're still struggling taking those prenatal vitamins, we will temporarily recommend taking a form of prenatal vitamin that doesn't contain iron, because that can, you know, upset their stomach less if they do that.
All small tweaks that can really make a big difference. And I've always heard that it's a sign that increase of hormone level is a good sign.
Yes.
Unfortunately, that kicks in that nausea, so it's not all bad.
Yes, absolutely.
All right. Dr. Ellie Hood, thank you so much for being in here. We sure appreciate all your advice because it's no fun to go through it.
Yes.
Thank you so much. Thanks for being here. We'll see you next Monday.